now I request Mr. Vijay Francis from Vision 8 to talk to us about their role so that all of us and mostly the newcomers will know about what is Vision 8 doing in the country and what way they can be connected to them. Vijay Francis.
Thank you, Dr. Vijay Lakshmi. Good afternoon to all of you. I'm really honored to be part of this wonderful event. And I'm actually speaking, in the midst of giants in the space, ophthalmologist, ophthalmic rehabilitation specialist. I'm a newcomer to this space. Actually, I've been working in this space for slightly more than a year now. What I'll do is I'll take about 15 minutes to give you an overview about Vision 8, our role in the area of vision rehabilitation in India. Vision 8's mission is to enable, educate, and empower people with vision impairment so that they can live a life of independence and dignity. With enable, what we are trying to do is we are trying to bring in rehabilitation services and affordable low-cost devices to people with vision impairment. Through Educate, we offer a comprehensive set of training programs that will help people with vision impairment to develop skills, as well as training programs that can help them, find gainful employment. And with the Empower, we try to provide the tools and skills that are required for people with vision impairment to succeed in the chosen profession, whether it is in this education space or in the professional journey. And how do we intend to do this? We intend to do this by setting up Vision 8 resource centers all across India. Vision 8 was founded in the year 2004 in Visakhapatnam in Andhra Pradesh. And the founders were Mr. Ramakrishna Raju and his wife, Ms. Revati Ramakrishna. In the initial years, Vision 8 was focused primarily in serving the cause of the vision impaired in and around the Vizag region. But over the last few years, we have expanded our scope and we today serve people all across India. We have a pan-India presence. And Vision 8 has two mirroring organizations, which we call as the Vision 8 USA, which is led by the founders. And then we have another organization in India, which is called Vision 8 India, which is led by Mr. V.L. Narasimhan, who is the member secretary of the organization. Vision 8 by far is a largely volunteer-driven organization. Almost all the board members and team members, both in USA and India, are 100% volunteers. But in India, we also have Vision 8 as a combination of volunteers, paid staff, and partners. The focus of the US organization is primarily towards defining the strategy and fundraising, whereas the focus of the India organization in terms of running the programs. This is something that you already seen. Dr. Sagitya actually spoke about the Vision 8's model. Now, each resource center that we intend to establish or we have established, we would like to offer these 16 different services or programs. Now, these services actually start with functional assessments or low vision assessment or early intervention programs, and then providing assistive devices at low affordable cost to people with vision disability. Then we offer a set of training programs, starting all the way from orientation and mobility, helping people to be able to navigate and move safely around. Computer training is one of the oldest and the very first training program that we started in Vision 8. And we help people to develop computer skills, learn the basics of computer as well as the screen reader software. And then mobile technology is to help people with vision impairment gain access to assistive technologies that are available online and be able to use it for living a life of independence and dignity. And the special skills training is one of the unique training programs that Vision Aid offers. We offer programs such as digital accessibility testing training, and also training program on Python programming language, as well as training programs on job coaching to take up competitive exams and so on and so forth. These special skills training help people to be able to find meaningful employment opportunities. Then we also offer Braille training and resources for people who have not been trained on Braille, especially people who start losing their vision later in their life. They may not be exposed to Braille technology. So we offer Braille training for such people. And then life skills program. This is for helping people to be able to cope up with the day-to-day life, the pressures of day-to-day life. Livelihood and employment assistance is to help people find employment. We work with several companies all across India, and we try to place people with the vision impairment in these companies, help them gain employment. Spoken English training is another important training program we offer. We offer 2 levels of spoken English training, one at the beginners level and another at an intermediate level. And then we also offer several programs in the area of counseling, advocacy, research and development, and so on and so forth. So there are about 16 different programs, services, or interventions you can call that we offer through our resource centers. Now, when Vision Aid was started, we realized that we cannot do everything by ourselves. And so we had to come together with like-minded organizations to be able to bring forth these programs and offer these services. So we started partnering with eye hospitals, community organizations, blind schools, and through our own set of online programs, we are able to touch the lives of hundreds and thousands of vision impaired folks all across India. Like mentioned earlier, Aravind Eye Hospital is one of our first partner among eye hospitals, and we are very proud to be associated with them for a long period of time. We also partner with several leading eye hospitals such as LV Prasad Eye Institute in Hyderabad, Shankara Nethralaya in Chennai, Voluntary Health Services in Chennai, Dr. Shroff's in Delhi. We work with community organizations such as Community Eye Care Foundation in Pune, Milton Community Center in Berhampur in Orissa, and Vision Aid's charitable services organization in Vizag. Among blind schools, we are working with close to about 15 to 20 blind schools across India, and our programs vary from each school to school. In some schools, we offer a plethora of services, including building infrastructure at the schools, offering training programs, and other assistive aids so that the students can benefit from it. And Vision Aid's online training program offered through our academy, through which we offer about 12 to 15 different training programs. And we train close to about 500 people every year through these training programs. We have been around for almost 17 years. What have we achieved so far, or where are we right now? We have 12 centers of excellence all across India. And through our comprehensive set of programs, we are able to touch the lives of close to about 5,000 plus beneficiaries every year through our partner network and directly working with people with vision impairment. We offer more than 1,000 assistive devices every year. We conduct more than 2,000 low vision screening across India, and we are able to train almost 1,000 plus students every year in various training programs. And there are 2 important things about Vision Aid. Vision Aid is one of the very few NGOs operating in India exclusively for the cause of the vision impaired people. The second thing is almost all the services that we offer are free of cost or at a very nominal rate, including offering low assistive devices. And we are able to do that because we have a very low overhead cost and we have a large volunteer engagement. In our training programs, we offer the best of breed in terms of training curriculum, either developed in-house or we take the best of breed curriculum that is offered already by other institutes across the world. We don't stop only with training people. We also help them find employment opportunities so that they can gainfully get employed and be able to live an independent and meaningful life. And Vision Aid has been a pioneer in the area of assistive devices. And we continue to invest in sophisticated technologies that will make the difference in the lives of people. Let me touch about our training programs. Like I earlier said, we offer close to about 12 to 15 different training programs. And our training programs are across various levels. We offer programs at the beginner's level for people with very little education or who want to develop skills that will help them in their day-to-day life activities. So we offer programs such as spoken English program at the beginner's level. We offer computer training at the beginner's level, mobile technology training, Braille training, and so on. Then we have programs at the intermediate level, which are slightly more advanced. And we offer programs in computer training, slightly advanced level programs, computer training programs at a slightly advanced level, and so on and so forth. And then at the advanced level, we offer several technology skill training programs and special skill training programs, such as digital accessibility testing training program in Python programming language, corporate skill development program, which focuses on developing soft skills for people with vision impairment, and job coaching, ability for students to be able to take up competitive exams. We continue to innovate, and on every year, we continue to introduce at least 2 or 3 new training programs. For example, recently we have introduced a new training program. It's an advanced level program on Microsoft Excel. This is a small video. I would like to play this small video where you can hear what our students have to say about our training programs.
English very fluently.
I gain discipline and I improve my skills.
I learnt more than I expected.
I'm no longer scared to speak in English.
I really appreciate Vision Aid who are giving chance to disabled to improve.
There are many other students who went on to get amazing jobs. Let's listen in.
I have received a full-time employee offer at Goldman Sachs as an analyst.
I am the founder director of EY's Consultancy Services Private Limited.
Job in data science field in X
I want to become a great singer in my future.
Currently, I am working as an accessibility tester in Almed Systems, Chennai.
I would like to now move on to the various other programs that Vision Aid offers. And today's event is about the Smart Vision device or the Smart Vision glasses. More than a year back, Vision Aid decided to partner with SHG Technologies to be able to bring an innovative new device that will be a game changer in the lives of people with vision impairment. Our role in this partnership is we provide financial support to SHG Technologies, which will help them to set up production capabilities in India. And we also collaborate with them on technology and other fronts to keep the product more sustainable and continue to evolve the product so that it can bring in new sophisticated technology to the market. And we also, using our network of eye hospitals and community centers, able to gain valuable feedback on the product and be able to pass it back into the organization. Thereby, we can develop a more sophisticated product. And we also help socialize the product across our partner organization and mobilize support for this product. And this event is a great example of how Vision Aid, Aravind Eye Care, and SHG Technologies, along with Rotary, have come together to be able to launch the second generation of this device. Another important program that we launched very recently is distributing smartphones to beneficiaries across India. And we launched this program about 4 months back. And we did a pilot where we distributed about 100 smartphones to beneficiaries all across India. The reason being, smartphone has become one of the most important assistive technology that is available for people with vision impairment. And we wanted to equip and empower these individuals so that they can use it not only for their day-to-day life activities, but also be able to use to get access to thousands of digital content that is available online and be able to develop online skills in these areas. And we actually are thrilled to announce that we are going to expand this program and be able to continue to offer these smartphones to beneficiaries all across India. And we'll be making this announcement very shortly. And in this program, we have partnered with another like-minded NGO by name Trees for Life. And they, along with Vision Aid, are being able to sponsor these smartphone devices. Like to play
I am visually
video
impaired.
about the smartphone.
Why is a smartphone important to me?
Life before a smartphone was totally different. It was very limited.
I used to face difficulty in reading books. I did not have any separate recorder or I was not aware of any screen reader.
Then came the smartphone. It transformed my world.
I used my phone as a window to the world, be it email, social media, or learning.
For example, if I need to walk to the nearest grocery store, so all I would need to do is click here and search for my location. It already shows up some suggestions, so whatever store I need to search for, all I need to do is I enter that, I hit search, and I hit the walk button.
I use the text-to-speech feature on smartphones to convert all text, whether it is email or books, to speech, so that I can access this information easily for learning or for doing my day-to-day work.
I installed applications like Ola, Uber, learned how to use it, and became independent.
My smartphone can also help me identify currency.
என் பெயர் என் கண்ணன். நான் பூரண்டவள்ளி பார்வையற்றோர் பள்ளியில் 11ஆம் வகுப்பு படிக்கிறேன். விஷன் எய்ட் என்ற நிறுவனம் எங்களுக்கு வழங்கிய ஸ்மார்ட் ஃபோன் என் படிப்பிற்கு மிகவும் பயனுள்ளதாக இருக்கிறது. அதனால் நான் விஷன் எய்டுக்கு மிகவும் கடமைப்பட்டுள்ளேன். நன்றி.
I also use my smartphone for pursuing online courses on an app called Khan Academy. So here's a quick demonstration of the home page. I enjoy taking courses on Khan Academy.
I often use the Be My Eyes app so I can have someone help me understand my surroundings as well as identify things for me.
It is one device without which I can't imagine my life. It is the one thing I rely on the most.
Vision Aid actually has been a pioneer in bringing in new innovative programs. One such program is the Digital Accessibility Testing and Training Center that was launched about 2 years back. Through this center, we offer training programs in digital accessibility testing. And this is a very hot area with high potential for employment, especially among IT organizations. And in a given year, we train anywhere between about 60 to 80 individuals and help them gain certification in digital accessibility testing. We use the curriculum developed by DQ Systems based in the USA, and they are the pioneers and foremost training organization in accessibility. We don't stop only with training. We also provide accessibility testing as a service for many clients across the world. And I'm glad to say that we have delivered projects to more than 5 clients over the last year or so. And we have 2 active clients with whom we work on an ongoing basis. And we continue to expand the space, try to help organizations become more accessible. Vision Aid Academy is an online portal that was developed some times back. And through this portal, we have started offering online training programs. We were earlier using this portal to offer training programs for potential trainers or future trainers, not only from Vision Aid, but also from our partner organization. But now we are expanding the scope of this portal to offer online training programs for students as well. And we'll be launching new programs very shortly. The other important program that we started working with about 6 months back is with an organization called the Raceline Foundation, who are the pioneers in producing digital tactile books that can help students learn science and maths and help them in the STEM education. And Vision Aid has partnered with them to provide such tactile materials to students all across India. And I'm glad to say that this year, we will be able to provide such materials to more than 600 students across various schools across India. Vision Aid also has been a leader in technology innovation for a long time, thanks to the work done by Mr. M.S. Raju, father of our founder, Mr. Ramakrishna Raju. These are some examples of devices that were pioneered or developed by Vision Aid over the years. Some of these devices have gone to win awards both in India as well as internationally. Vision Aid has the service rendered by Vision Aid by its founders have been recognized by various organizations. Most recently, Harvard University awarded Ramakrishna Raju the Direct Public Service Award, and the India New England chapter recognized Ms. Revati Ramakrishna as the Woman of the Year award. That is the end of my presentation. I'm really thankful to Dr. Vijay Lakshmi and Flora and Mr. Narasimhan for giving me this opportunity to speak in this event. I hope this information was helpful to you. If you'd like to contact Vision Aid, these are our coordinates. You can reach us on our website at visionaid.org or visionaidindia.org. Or if you want to write to us, you can do so at info@visionaid.org. Thank you so much.
Next talk is Journey of Vision Rehabilitation by Dr. Saitya Bhaskaran. And she is a consultant in the Department of Pediatric Ophthalmology and Strabismus and the head of the Department of Vision Rehabilitation Service. She is passionately involved in pediatric vision rehabilitation and actively participates to promote early intervention in children with special needs. Now she will share her experience how we strengthened vision rehabilitation service in Aravind Low Hospital, Madurai, along with Vision Aid.
Good morning, everyone. I'm just sharing my PPT. Flora, are my slides visible?
Yes, ma'am, it's visible, ma'am.
Thank you. So good morning, I'm Dr. Saitya, and today I'm really thrilled to be part of this event. I thank Dr. Vijay Madam for this opportunity and also Vision Aid for this wonderful opportunity. So today I'll be talking on journey of our Vision Rehabilitation Center, the Aravind Vision Aid collaboration, and how we expanded our services. So what started as a small low vision clinic in a cabin in 1999 with one part-time ophthalmologist and a rehabilitationist grew on to become an independent department, the Vision Rehabilitation Center. And now with the help of Vision Aid, we are a proud national resource center. So we started as a team of one ophthalmologist, rehabilitationist, and optometrist, and our scope of services included low vision assessment and functional vision assessment across all age groups, prescribing, dispensing LVDs, and basic training for adult rehab and for children. However, today we are a department with a full team in our own right. We have 2 ophthalmologists, 1 rehabilitationist, a special educator, and a couple of trainers giving a full-fledged rehab in the department. And despite being one of the earliest institutes to start vision rehabilitation, we still face considerable barriers and challenges in taking our services to the community at large. This slide was also shown by Madam, and she showed how these affordability, accessibility, and lack of trained professionals is being a hurdle. When you come to affordability, these LVDs are pretty expensive, even the basic ones. I'm not talking about the high-end gadgets, even the basic ones as compared to a pair of glasses, sometimes even to a few surgical procedures, these LVDs become expensive. And also training programs, affordability towards training programs. When patients come to an eye hospital, they come looking for some kind of treatment to restore their sight. They're not really ready, or there's no mindset to afford or to put in so much money or effort for rehabilitation. They don't come into a hospital looking for rehab actually. Next comes access. Whenever they need to access all these services, they will have to walk into a tertiary center. So somewhere in the primary or secondary centers, this concept of rehabilitation is practically non-existent. So when we're talking of these patients coming into the hospital for training or even for a day's checkup, it means 1 day's loss of daily wage, transportation, food, accommodation, everything becomes a financial burden. And lack of trained professional. Of all the hurdles that we're facing, this is one huge thing, because there are lack of trainers itself. You really can't refer them here and there to get trained, because dedicated vision rehabilitationists are only a handful in the country. And when you look at children with multi-disability, this becomes even more difficult because we don't have professional trainers or rehabilitationists. This is where Vision Aid comes in. And Vision Aid is a non-profitable organization which works with a vision to enable, educate, and empower persons with vision-related disabilities. When like-minded organizations converge, the journey gets really interesting. So once Vision Aid and Aravind started collaborating, so how did we move ahead? Like you can see, this is the 16-part domains across which they had structured programs for rehabilitation. A few of this we were already providing at Aravind, and there were a few which we had to strengthen. So today I'll broadly talk on these 3 areas where Vision Aid helped us expand. The first was infrastructure. Though we had a dedicated department for vision rehabilitation, after Vision Aid came in, we had professionals. Dr. Khan visited us multiple times to help us create this department. We expanded the department. We also created a space which was very much disability friendly. We had designated spaces for both examination and for training. And today we are at a very prime location in Aravind, Madurai, with a beautiful department which is fully equipped. And next, coming to patient services, subsidized LVDs. Like I said, LVDs are pretty costly.
जस्ट कंप्लीट की थी ना तो मैं यहाँ आई थी तो वही नहीं ज्वाइन किया था जहाँ बहुत रहते क्योंकि मैंने डिप्लोमा ऑर्थोपेडिक्स में था ना तो बहुत चाह रहे थे कि मैं ज्वाइन कर लूँ
subsidized LVDs. So Vision Aid, with the help of Vision Aid, we were able to provide subsidized LVDs to our patients. Once these LVDs come at a subsidized cost, say pocket magnifiers and even mobility devices which were locally made. So once this is being provided, this also increased the patient acceptance towards low vision devices. And also spectacles. Now, more than this LVD, spectacles coming at a subsidized cost was even better. Because as you know, in patients with vision impairment, these spectacles are almost expensive. They're not like the routine refractive error spectacles. They're usually high powered, so they require special coats or tints. And these spectacles, these special spectacles are not covered under any camp, or mostly they are not provided at a subsidized cost, and they don't buy also, and they get damaged very easily. You see patients keeping them for years together. So when we were able to provide spectacles at subsidized cost, this also increased our patient acceptance. The early intervention program, we already had an early intervention program, which was institution based, but with just one rehabilitationist, there was not much we could do in the institution. We'd just tell them what to do and send them. So now we are able to provide both institution based and home based trainings. Now with the rise in COVID pandemic, we have also started a online vision rehabilitation. I'll just play the small video where you can see my special educator instructing the child through online or Zoom platform. So the mother is doing it for the child there. So this is how she's been providing online vision therapy. So during the COVID pandemic in the first wave, when we were not able to get our patients to come to the institute, we lost a lot of patients and they started regressing back on milestones, and that is never fair. a child who's vulnerable, who's weak, should always get what it is his right to get rehabilitation. So now, when the pandemic started to wane off, we were able to provide 4 to 5 children with institute-based rehabilitation on a daily basis. And when there's this lockdown and cases start increasing, always we switch over to online therapy. And for us, luckily, this online has worked very well, and we have almost all of our patients on loop taking this online vision therapy. Coming on to orientation and mobility, initially we were able to provide only white cane training to adults, and that also only after the teens are over. I mean, almost 16, 17 years, late teens only we'll start providing. But now we have started for children also, starting from the age of 1 year, using native walkers or strollers. So all these things, and even locally made mobility devices like the torch, the VI torch, has also been started. So mobility training has started very, very early in the part of early intervention program, and this has given a lot of children confidence, and working up once mobility has started has also become easier. The special school camps, like I said, this is another major thing that we were able to achieve with Vision Aid's help. We started doing special school camps for children with multi-disabilities. So standard ophthalmological treatment examination as well as functional vision assessment was being done. We used our traditional in-house methods like Vikas and all also. So we were able to provide glasses, we were able to refer them for higher optal workup, and for CVI or for functional vision, we were able to provide exercises in the hospital, in the school setup itself. So the number of special schools, almost 16 schools, and children, more than 500 children now. As you can see, the refractive error rates were also very high in these children. So these children almost deserve, but routine school screening programs will not include these special schools. So this was a very big milestone for us. And the digital resource training as a certified course and a 60-hour structured training we are providing. And now again with the rise in COVID pandemic, we're doing an online training for digital resources as well. Almost 4 to 5 persons with VI per hour also we're able to connect. And this boy here, this is the youngest we have trained in computers. He's only 5 years old. And now he's able to work on the keyboard pretty well. The Braille training, this was something we had never ventured into. Again, with the COVID pandemic, we had these 2 kids come in asking if we could help them with their lessons of 8th standard, because the schools had shut and they had no way of learning. They're both congenital visually impaired children. They were doing their education in Braille. So then we started getting Braille typewriters, started helping them with Braille. And now we are able to shift these children to Orbit Reader, where they can read their routine PDF documents or soft copy documents in Braille, and they can also type into it. Now with help of Vision Aid and Riceline Foundation, we're getting these embossed books, because for children with congenital VI, starting concepts early becomes very, very important. So these embossed books with RLF Foundation has helped us expand our venture also into Braille and congenital VI habilitation. This modified kitchen for persons with VI, this is especially for our patients who have become adventitiously blind or secondary blind after a few years into their lives. So a modular kitchen, the routine rehabilitation with kitchen base doesn't work for most of our patients, because from rural background, they want to know what they can do in their own kitchen. So we give them a modular kitchen, we give them a stove, which is all those electrical gadgets they don't want. They want to work in their kitchen. So we made it user friendly for them. We wanted to know what they wanted, and we tried to work along changing their own kitchen methods so that they'll start using it. Next, coming to strengthening human resources. So training rehab professionals at Vizag. So our own trainers also get routine trainings at Vizag and update their own skills so that they'll be able to train our patients better. Next was strengthening Aravind Low vision services across our sister concerns. Like you can see across the state, we have multiple secondary centers and also tertiary care centers. So we had this capacity building program where each secondary center and tertiary center sent in a team of low vision people with one MLOP or an optometrist who was going to take care of the low vision department and also the ophthalmologist. And we had a 3-day program where all our existing services were being transferred to our sister concerns as well. And the next, coming to the KSOS training program, this was a very commendable initiative from the Kerala State Ophthalmic Society, where they had identified 3 zones and they were setting up low vision centers in their state. And we started with 3 major hospitals, and we had their optometrists for over a month who were trained, and then they started their own vision enhancement centers in their state, and now they train the other centers as well. Also, we had professional guidance for occupational therapy, so on and so forth, for our special educator at frequent intervals, so that we are able to give a wholesome rehabilitation to our children with special needs, and training the trainer. So with all these COVID pandemic and schools closing, so we wanted to train special teachers from VI schools in NVDA and in computer, so that they will be able to take it to their children. We are only able to train a handful who come to us. So when we train these teachers from the blind schools, they are able to train their children in their computer lab. So this is that training which is happening for the special school teachers. And the continued medical education CME programs, where we started exhibiting our vision rehab services. We also put out a lot of exhibits where our own doctors were becoming familiar with the services that were provided. Otherwise, this is one department where nobody knows what is happening. You send the patient and the patient goes home from there. They never go back to the doctor and say that I got this or I got that. Doctors also don't ask. So now that we were able to tell our own fraternity that all this is happening, so if you have a patient, you can always send to us. So this CME and other conferences, now even on the virtual platform, we continuously keep exhibiting that these things are happening in the department. So please keep sending patients to us. And the Vision Aid Muscatee Scholarship, where even after the basic training program that is being provided, Vision Aid still handholds all our patients and persons with VI, covering all costs of an extensive 6-month residential training program in computer applications, mobile technologies, coaching for banking and soft skills, spoken English skills, etc. This is also being provided, and every patient who comes in for training keeps getting these brochures from where, I mean, if after finishing this basic course with us, they can always take it up with Vision Aid for advanced training. Now the feather in the cap is Smart Vision, which is a wearable device incorporating artificial intelligence, machine vision, and machine learning to recognize objects, read text, recognize faces, and navigation. Now this is being dispensed at Aravind, and with Vision Aid's help, this is come into the market as well. We had only one such device, which is OrCam, and which was priced at whopping 4.5 lakhs, which was not affordable to anybody. So now we have the Smart Vision, which is very, very affordable, around 25 to 30,000 a piece. And this has worked very well for so many patients, for so many young adults, and also children, even children with learning disabilities are benefiting from this product now. And now recently, this was a program that was held by Vijay ma'am and Aravind, the Smart View through Technology's Eyes, where it was where all these people with visual impairment were provided with smartphones. This was just held on Jan 4th. So this is how, like I said, when like-minded organizations converge, the journey becomes very rewarding and very interesting. And this journey is bound to continue. And at this point, I'd like to thank Vision Aid for helping us expand this far. And it's not thanks, it's gratitude to Vijay madam for thinking at such large, it is almost like not many people would dream of creating such a big rehabilitation center and try to expand and seed vision rehabilitation centers everywhere. So what she's doing at this stage, being a driving force, is very, very commendable, and it's only gratitude that we have to express. And to end, my favorite quote: when you treat a disease, you may win, you may lose, But when you treat a person, there's no other way. There's only one way, and you win, no matter the outcome. So thank you so much. And thank you so much for the opportunity as well.
Hello, good morning, everybody. This is Narsimhan from Vision Aid India. Welcome to all of you. Especially thanks for Dr. Vijay Lakshmi and Dr. Sahitya for such kind acknowledgement of the role of Vision Aid in providing the rehabilitation center facility at Aravind Eye Hospital, Madurai. We are very, very proud to partner with them. They are the first eye hospital partner of Vision Aid in India. Okay, thank you very much and welcome all again.